Hello, I'm Dr. David Saperstein, the director for the Center for Complex Neurology, EDS, and POTS in Phoenix, Arizona. I'd like to talk about something called cranial cervical instability, or CCI. So in some patients with EDS, because of their hypermobility, they can develop problems with how the base of the skull sits on the cervical spine. And that can develop just from wear and tear or over time with abnormal or excessive flexibility and mobility, or oftentimes we'll see it in people who have had injuries that sort of set things off track. We definitely know that some people have problems from CCI. It can be very hard to A, diagnose whether CCI is present or not, and B, figure out if there is CCI, how much of a problem or what sort of problem that's causing for a patient. Let me explain a little more. So as I mentioned, an important issue is the relationship of the base of the skull and the cervical spine or the neck. And if that angle is tipped forward a little bit, then that can put traction on the base of the brain, something called the brainstem, or the top of the cervical spine. And a lot of important functions are involved in that area. So if there are problems due to CCI affecting the base of the brain and the top of the cervical spine, patients may have dizziness, trouble swallowing, trouble speaking, slurred speech, problems with their vision, problems with their hearing, ringing in their ears. And oftentimes we'll see dizziness, lightheadedness, other issues with regulation of blood pressure and heart rates, rapid heart rates, abnormal sweating, abnormal digestive issues, brain fog, fatigue, so headaches. You can see quite a lot of problems. And there can be other reasons why people with EDS have those problems. And I encourage you to look at other videos that we have on issues such as POTS and dysautonomia and mast cell activation syndrome. So again, that's where it gets very complicated. So sometimes CCI is a variable in all of this, and sometimes it isn't. How we determine if somebody has CCI, of course, like in most things in medicine, we start by figuring out what symptoms you have, examining you, and seeing if there are clues there. Patients with CCI will often describe that it feels like their head is too heavy for their neck. They feel like they have a bobblehead, or their neck just isn't supporting their head. Again, those symptoms in and of themselves aren't proof or doesn't absolutely mean somebody has CCI, but it gets us thinking about it, gets us suspicious. There are a number of radiologic studies that can be useful. Plain x-rays could be used, CT scans, MRI. MRI of the cervical spine generally is the most used and most helpful. That allows us to get good views of the base of the brain, excellent views of the spinal cord, good views of the vertebrae bones, and we can get a lot of information. X-rays, of course, will just show us bones and none of the neural structures. CT scans can show us both, but not the same resolution that the MRI can, although CT scans can give us better views of the bone, but involves radiation. What type of MRI scan? So sometimes people advocate using a so-called upright MRI, where somebody's standing, so we get to see the effects of gravity. We can have the neck move. People can do flexion and extension of the head. There are trade-offs. The open MRIs, or the upright MRIs, are what we call open scans. So the signal gets more diffuse and the pictures basically are often more blurry. A traditional MRI, where somebody's lying flat, is a closed MRI, and we can get much better pictures. And particularly the newer generation MRI scans can give us much better pictures, and we don't have that magnet strength available on the upright MRIs. So based on all the pluses and minuses, my preference is to go with a conventional MRI laying flat. There's something called DMX, or dynamic X-ray, that uses what we call fluoroscopy, where the x-rays are continuous. It's a video, and the neck and the head are moved through different positions. Lots of measurements can be made. The problem with DMX is it's not widely available. It's generally not covered by insurance, can be quite expensive. And again, we're not exactly sure what those measurements mean. So again, most specialists who deal with CCI look at MRIs. There are specific measurements that are made. So if you go and have an MRI scan on a routine basis, the radiologist isn't going to make those measurements. If requested, most neuroradiologists can and will make those measurements. Here at the center, we make those measurements ourselves, and me as a neurologist like to look at the films myself and make those measurements. So there are several measurements that can be looked at. One is the 𝐒𝐲𝐦𝐻𝐿 angle, another is called the 𝐲𝐬𝐥𝐮𝐝, and they're just measures of the angle of the skull, how much space there is between the vertebrae bones and the spinal cord, and there's some information on our website that gives much more details about that. Just having an abnormal measurement doesn't mean that there's something wrong. We know that people with EDS are extra flexible, and nobody's really done an elaborate study to see what the spectrum of measurements is in somebody with EDS versus the normal population. So we need more. We need certain symptoms, or we need certain factors that impact the symptoms. So again, people do it different ways. There are some specialists who will use traction. So traction, raising up, pulling the head up, pulling the neck into a little bit better alignment, or the skull and the neck into better alignment. This could be done manually, oftentimes by a physical therapist. There are certain devices that can do it. It's typically a very safe endeavor to do. And we see, do certain symptoms get better? I listed the large number of symptoms that can be associated with CCI. And then if with traction we see a sustained and reproducible benefit in a number of symptoms and a significant enough benefit, then that would encourage us that CCI is playing a role. Traction can help many other things. If somebody has a pinched nerve, for instance, that can help pain and so forth. So it's not always proof that there's CCI. Since CCI can impact so many issues, and particularly can affect what we call the autonomic nervous system, as I mentioned, it can cause people to have dizziness, lightheadedness, rapid heart rate, gastrointestinal symptoms. It can be very important to determine if CCI is affecting those functions, or if other aspects of EDS and other diseases and conditions are affecting the autonomic nervous system. So to figure out the best way to treat it, we need to investigate the CCI. So because of that need, I've come up with a program here at the Center for Complex Neurology, EDS and POTS, to help us sort through this. So of course, evaluating MRIs, making the appropriate measurements, and then looking at function of the neck muscle. So here I have a device called the MCU multi-cervical unit, and this allows us to make very precise measurements of range of motion of the neck, allows us to make precise measurements of the strength of individual muscles that move the head in different way. And we have a separate video on the MCU, and I encourage you to look at that. We use certain so-called electrodiagnostic tests. So we do brainstem evoked potentials and other reflex tests where basically we measure how well electrical signals go through the base of the brain, that brainstem, or the upper part of the cervical spine. And we can compare what the readings look like in normal position, what they look like with traction applied, what they can look like with people lying down, and changes in different states or different maneuvers can tell us the impact that CCI might be playing. And then how do you treat CCI? So we start with physical therapy. Sometimes it can be very hard to target specific muscles in the neck, and that's where we found the MCU, the multi-cervical unit, to be very valuable. It can allow us to identify specific muscles that are weak, and then utilizing this equipment, target those muscles and gently strengthen them and build that up over time, over the course of several weeks, strengthen and equalize those muscles to restabilize the neck. Sometimes people need other treatments. We don't know if prolotherapy or PRP or other sorts of injections help, but those are treatments that are sometimes used. They're more invasive, certainly, than PT or the MCU. And then on the more extreme end, there are some patients who undergo surgeries where they have their back of their skull fused to their cervical spine, so-called occipital cervical fusion. As you can imagine, that's a big surgery to undertake. It leaves some degree of restricted movement of the neck. And there are only a very small handful of surgeons right now who do this sort of surgery in individuals with EDS. So requires going to the East Coast and seeing one of these surgeons. As with all things medical issues, we start with the least aggressive treatment and we see how effective it can be. Again, if CCI is present or suggestion of CCI is present on the scan, but it doesn't seem to be a big factor based on our evaluation, based on what we find with the MCU, then we can focus on other issues. We can focus on treating autonomic disorders. We can focus on treating mast cell activation syndrome if that's present. To summarize, CCI, cranial cervical instability, can be a problem for individuals with EDS, but fortunately for most individuals, that's not the largest problem, and there are tests that are available to help us sort out who requires more focused treatment for CCI and who do not, and then how to determine when and how to move along that continuum of treatment. Thank you.